I'm Jamie Friedman with Colorado Springs Orthopaedic Group. Today we're talking about cartilage restoration. Cartilage restoration is not for everybody. It's for a young person, maybe in their teens, 20s, 30s, even 40s, who are too young for a total joint replacement. The great thing about cartilage restoration is we can really avoid a total knee replacement in somebody who is a young athletic person. Sometimes we can treat cartilage damage conservatively with rest, ice, anti-inflammatories. Sometimes we'll do things like a steroid injection. There are really two types of cartilage restoration when we think of it. There's resurfacing and reconstruction. So the way I think of this is like, do we need to just repave the street with a superficial fix? Or is there a pothole that we need to kind of reconstruct and fill in? The superficial ones can just be putting cells in that area, in that defect, and allowing your body to make new cartilage. If we need to do a pothole, then we need to actually put bone and cartilage in that defect and allow it to heal. I'm really excited. We've done a new procedure in Colorado. I'm the first one to completely resurface the patella with biologics. So we've taken the undersurface of the kneecap and put donor cartilage in there and completely reconstructed it. This patient is a marathon runner. He runs quite a bit of mileage every week, and over time his cartilage wore away, particularly underneath the kneecap. The patient is now about 8 weeks out from surgery and doing excellent. In fact, he's actually signed up for his first postoperative marathon later this year. Physical therapy in the clinic and at home is critical to have a good outcome after these surgeries. It takes a lot of hard work on regaining range of motion and regaining strength in the knee. It can range from several weeks to several months. Our goal at the end of rehabilitation process is really full function without restrictions. If you love skiing, if you love running, whatever you love to do, we get you there. If your knee pain persists despite conservative treatment like rest, ice, anti-inflammatories, then come see us at csog.net or give us a call to schedule an appointment.